Welcome, my dear students. Welcome all. Initially, I dedicate my sincere thanks to NCH and all the organizing team to give me this wonderful opportunity. In today's session, we are going to study treatment basic principles of Ayurveda, that is Kaya Chikitsa, as explained by Ayurvedic classics. Let us first go through learning objectives of this session. At the end of this session, first year homeopathy students should be able to define and understand meaning of the word Kaya Chikitsa, to know the aims and objectives of Ayurveda, know what are the 8 branches of Ayurveda, know chief causes of disease as per Ayurveda, know stages of a disease as described by Ayurveda, know the 4 pillars of treatment, understand types of Kaya Chikitsa, understand basic principles of drug action, and to know the meaning of Rasayan, Vajikaran, Shalyakarma, Agnikarma, and Ksharakarma. Ayurveda means the science of life, and so it deals with every aspect of life. Ayurveda basically has 2 aims, as stated by Maharshi Charak. Ayurvedasya prayojanam swasthasya swasthya rakshanam aturasya vikara prashamanam cha, which means prevention and promotion of positive health is the primary aim of Ayurveda, and secondly, cure from the disease. Ayurveda is divided into 8 branches which unanimously achieve specific needs in the process of maintaining health and preventing disease. These 8 branches of Ayurveda are Kaya Chikitsa, which means general medicine, Balatantra, which means treatment of diseases related to infants. In short, we call it as pediatrics. Graha Chikitsa, use of Jyotish Shastra for treatment purpose. Urdhvanga Chikitsa, that is in today's terminology ENT and ophthalmology. Shalya Chikitsa, to which we know as surgery. Visha Chikitsa, which we know as toxicology in modern terms. Rasayan Chikitsa, to increase health status and longevity, that is one's lifespan. And the 8th one is Vajikaran, means to improve reproductive quality of an individual for better progeny. Out of these 8 branches, Kaya Chikitsa, Rasayan and Vajikaran are described under Kaya Chikitsa. Kaya Chikitsa basically deals with the treatment of general systemic diseases. There are number of definitions of the word Kaya as we can see here on the screen. From all the above definitions, it is clear that Kaya have different meanings like mind, heart, body and Agni, that is digestive fire. Out of them, in Ayurveda, Sharira or Sharira, that is body, and digestive fire, that is Jatharagni, have a positive correlation with the word Kaya. Because entire therapeutics of Ayurveda is based on the concept of Sharira and Jatharagni. Ayurveda considers Sharir as a union of body, mind and soul. Also, the concept of Kaya, meaning Agni, is a unique concept of Ayurveda, is a peculiar concept of Ayurveda and is responsible for biotransformation. As it is a known fact that in human body, Agni provides necessary energy for all types of bodily activities. The biological system of the body transforms this energy to one which is utilized by the cells for their further growth and development. And the second part of the word Kaya Chikitsa, Chikitsa is defined as Roga Pratikare Roga Nivaranopayaha, which means to arrest and cure the disease. Another definition of Kaya Chikitsa says, Yabhi Kriyabhi Jayante Sharire Dhatavaha Samaha Sa Chikitsa Vikaranam, which means Chikitsa is anything by which the imbalance occurred in the body is brought back to normalcy and health is restored. So, overall, Kaya Chikitsa means the treatment of generalized or systemic diseases. In Kaya Chikitsa, the measures like diet, daily regimen, therapies, medicines, etc. are employed to bring about equilibrium of this body. According to Kaya Chikitsa, most of the diseases are the result of an imbalance in the harmony of Tridoshas. that is Vata, Pitta, and Kapha in the body. Ayurveda also believes that diseases are caused due to imbalance of the digestive fire, that is Agni. Kaya Chikitsa discusses the events in the body resulting in this imbalance, the reasons for this imbalance, the procedure of formation of a disease. Thus, pathology and diagnosis part is also covered under Kaya Chikitsa. Kaya Chikitsa provides several measures to maintain the balance between these three dosha and deals with the correction of Agni, which in turn helps in restoration of health. Moreover, Kaya Chikitsa also tells how to maintain a harmony between the body, mind, and soul. So, it finds its parallel in modern discipline of general medicines. Ayurveda has basically explained 6 stages of a disease, which includes the first stage is called as Sanchaya, that is aggravation of dosha, Prakopa, which means accumulation of dosha, Prasara means overflow of dosha, Sthana Samshraya means relocation of dosha, Vyakti, that is manifestation of symptoms of a particular disease, and lastly Bheda means further course and consequences in the form of after effects of the disease. Kaya Chikitsa also discusses various measures to arrest any disease in any of these 6 stages of its progress. As per Ayurvedic classics, our body is made up of 7 types of dhatus, namely Rasa, Rakta, Mamsa, Meda, Asthi, Majja, and Shukra. Kaya Chikitsa, with the help of several medications and physical and mental therapies, helps in restoration of normalcy of these factors in our body, and thus keeping us healthy. And hence, Vishuddha Chikitsa, or purest and perfect treatment, has absolutely no side effects to the patient. Let us take a quick look over scope and limitations of Kaya Chikitsa. Kaya Chikitsa considers physiological disorders, generalized infections, degenerative diseases, allergies, deficiency disorders, and systemic diseases like musculoskeletal disorders, nervous disorders, psychosomatic disorders, cardiovascular diseases, endocrine disorders, diseases related to digestion, etc. But Kaya Chikitsa does not include surgical disorders, anatomical disorders, and specialized branches of medicine like gynecology and obstetrics, pediatrics, ENT and ophthalmology, toxicology, etc. Let us go through a very peculiar concept described by Ayurveda classics, namely Chikitsa Chatushpad. Ayurveda classics describe that the success of Chikitsa, that is treatment, rests entirely upon four important factors analogous to the four legs that support a table, and hence are called as Chikitsa Chatushpada, or the four pillars of a successful treatment. They are Bhishak, means a qualified and skilled physician. Dravya, means medicine. Upasthata, means skilled nursing assistant. And Rogi, means patient. Ayurveda classics describe a minimum of four qualities for each of these pillars. The Bhishak comes first in the order of importance. So, a wise physician necessarily should have four qualities, as have learned from pure source of knowledge, acquired sufficient practical experience of application of the science. Physician should be alert always, and he must be pure by mind and intentions. Next in importance is Dravya. Physician is unable to perform his regular duties in absence of drug. So, following four qualities are at most essential for a good drug. It must be abundantly available. Drug should have dependable and valuable qualities with wide scope of applicability. Drug should have capability to go through multiple formulations, and the drug should have all pharmacological characteristics. Next one is Upasthata, or a nursing assistant. Helping a deceased one is a great task, and it cannot be performed by everyone. The nursing assistant is very much important for treatment to become successful. This nursing assistant should possess these four qualities. He must be aware of the treatment protocol. He should be alert always. He should have sympathy for the patient, and he should be clear by mind and intentions. And fourth, and an important part of chikitsa is the patient itself. As described by Ayurvedic texts, patient must have following four qualities. Patient must be having good memory and recalling capacity. Patient must be obedient to instructions of the physician. Patient should be courageous with balanced mind, and the patient should be able to describe their ailments. Besides qualities of these four pillars of treatment, Kaya Chikitsa also explains ethics of medical practice. Ayurvedic texts have in detail explanation about how a physician should behave. Let us take a short overview of this explanation of medical ethics. An ideal physician should listen and respond to patients' needs, should extend its professional courtesy by asking significant questions, should show respect, and should place patients' needs before his own personal gain. A good physician work as a member of team with patient's family, and other healthcare professionals. A good physician will be an expert in his field and remain up to date on the latest treatment and research. The physician should work empathetically and cooperative with the patient by explaining treatment options, and should take into consideration patient's requests and needs. A good physician should not take advantage of its position and power. He should remain ethical and honest. This is a very short glimpse of explanation of medical ethics in Ayurvedic literature. Going forward, let's now see different divisions and types of Kaya Chikitsa. Ayurvedic treatment, that is Kaya Chikitsa, is chiefly divided into two branches, namely Shodhana Chikitsa and Shamana Chikitsa. Shodhana Chikitsa is the removal of all accumulated toxins from the chronically diseased body-mind complex through the natural openings of human body. When these toxins are eliminated, the dynamic equilibrium within the body is restored to normalcy. The process of Shodhan is classified into three stages. Purva Karma means preparatory phase of Shodhan Karma. Pradhana Karma, which means treatment phase of Shodhan, and Paschat Karma means post-treatment phase of Shodhan. Today, this Shodhana Chikitsa is popularly known as Panchakarma. Let's take a quick overlook of the types of Shodhan. Shodhan treatment expels imbalanced doshas out of the body forcibly. It is of five kinds, and hence it is popularly known as Panchakarma, where Pancha means five and Karma means procedures. The five types are Niruha, which means decoction enema. Vamana means controlled emesis or vomiting therapy. Virechana means purgation therapy. Nasya means installation of medicines through nasal route, especially used for ENT and eye related disorders. And Raktamokshana means bloodletting. Shamana Chikitsa refers to all the Ayurveda procedures and protocols that reduce, suppress, and eliminate the disease symptoms. This form of Kaya Chikitsa pacifies the body by balancing the Tridosh, that is, Vata, Pitta, and Kapha, and bringing them back to normalcy. These treatments are primarily focused on Ayurveda medication and recipes that deliver just the right combination of nutrients and medicinal effects that your body needs based on your medical condition. These medications, along with prescribed dietary and behavioral regimes, help to correct imbalance of dosha, agni, and dhatu through simple oral and external applications, as well as in delicate detoxification. Let us take a quick overlook of the types of Shamana Chikitsa. Shamana, or the palliative treatment, is that which does not expel the increased dosha out of the body. It does not increase the normal dosha, but make abnormal dosha normal. In short, Shamana treatment brings imbalanced dosha to normalcy. This Shamana Chikitsa is of 7 types, namely Pachana, means use of digestive or carminative medicines. Dipana means use of hunger producing or stomachic medicines. Kshut means withstanding hunger or avoidance of food, to which we call as fasting. Trut means withstanding thirst or avoidance of water drinking and avoid liquid food intake too. Vyayama means physical activity or vigorous exercise. Atapa means exposure to sunlight, or popularly known as sunbath. And lastly, Maruta means explore to breeze. One of the most important and unique ingredient of Shamana Chikitsa is Ayurvedic herbal medicines, which is rather USP of Ayurveda. Most of the medicines used for Shamana Chikitsa are of herbal origin. Ayurveda has developed a separate branch named Dravya Guna Vidyan for scientific study of various plants, their characteristics, and their mode of action in the body. Action of any herbal drug in the body depends upon 5 fundamental characteristics of a drug known as Rasapanchak. Rasapanchak means rasa, guna, virya, vipak, and prabhav. These five characteristics of any drug decide its mode of action. Rasa means taste of the drug. There are six in numbers, namely sweet, sour, salty, pungent, bitter, and astringent. Every taste has a specific role over three dosha. Guna means physical properties of a drug. They are further classified into 20 groups. Virya means potency of the drug. It is of two types, namely Ushna and Shita. Vipaka means the taste of the drug after digestion. There are three types of vipaka, namely sweet, sour, and pungent. And the fifth and the last one is prabhav, which means a specific action of that drug. Any herbal drug acts in accordance to these five characteristics. Considering this, Dravya Guna studies the plant as a whole, decides Rasapanchak, predicts its action in the body, and thus uses it as a medicine. Many preparations of Shamana Aushadhi are combinations of various herbs based on these fundamental principles. Shamana Chikitsa uses medicines in various forms like Leyha, Kashaya, Churna, Arishta, Taila, Lepam, Bhasma, other formulations in the form of tablets. Kaya Chikitsa is also divided in another two types, namely Santarpana and Apatarpana. Santarpana means nourishing and enriching. So, medicines or the procedures used for nourishing the body are called as Santarpana Chikitsa. Santarpana is also called as Bruhana. Bruhana therapy brings strength and nourishment of the body and hence arrests the disease, while Apatarpana means depleting or cleansing. So, medications or the procedures used for depleting the bodily dosha are called as Apatarpana Chikitsa. Apatarpana is also called as Langhana. Langhana therapy brings keenness and clarity of sense organs, improves digestion and metabolism, and thus decreases the severity of a disease by bringing back the dosha to their normalcy. Dietary intake of a patient keeps much importance in success of treatment. Ayurvedic classics say, Ahara sambhavam vastu, rogaha cha ahara sambhavaha, hitahita visheshacha visheshaha sukha dukkhayoh. In this shlok, Maharshi Charak proclaimed that the human body is born out of the diet and all the diseases too are produced due to vicious and faulty diet. The hitakar or proper diet brings sukha and ahitakar or faulty diets bring dukkha to an individual. Diet and lifestyle are extremely important in the management of a disease. So, Ayurveda strongly stressed on diet and lifestyle measures for the prevention and management of a disease. Food and regimen, which is congenital, suitable, protects the body's strength and control its vitiated condition and helps in growth and development is called as pathya. On the other hand, any food and regimen that is not beneficial to health is called as apathya. In Kaya Chikitsa, in treatment protocol of any disease, rules regarding pathya and apathya ahara secure an important and initial place. Next, most important aspects of Kaya Chikitsa are Rasayan Chikitsa and Vajikaran Chikitsa. Rasayan Chikitsa is also known as rejuvenation therapy. Ayurveda has a philosophy to establish good health rather than just curing the disease. Rasayan is an active step towards achieving this. Let's take a quick overlook of benefits of Rasayan therapy. It enhances the intelligence, memory power, willpower, body strength, skin complexion, sweetness of voice, and physical strength. It nourishes the blood, lymph, flesh, fat, and semen, and thus prevents chronic degenerative changes and illness. Rasayan improves metabolic processes which result in the best possible biotransformation and produce the best quality bodily tissues and eradicates senility and other diseases of old age. It helps to attain optimum physical strength and sharpness of sense organs. Rasayan has marked action on reproductive organs and also nourishes Shukra Dhatu. Rasayan nourishes the whole body and improves natural resistance against infection by increasing immunity power. Rasayan therapy, which regulates the circulation of vital fluid and eliminates the waste material, rejuvenate the nervous system and keep vigor and stamina. And the most important is Rasayan therapy keeps the mind pleasant. The word Vajikaran is composed of two words, that is Vaji and Karan. Vaji means horse. It is a symbol of sexual potency and performance. And Karana means power. Vajikaran therapy improves the function of reproductive organs and vitalizes reproductive tissues, improves the health of semen, and strengthens sperm motility in men. Thus, Vajikaran is meant for better quality progeny. One of the important branches of Ayurveda is Shalya Tantra. Though actually not counted under Kaya Chikitsa, let us take a quick review of this peculiar branch of Ashtanga. In Ayurveda, Shalya means anything which disturbs normal body functions. It may be a foreign body or any body part itself which is now diseased up to an extent that it should be removed out from the body. And Shalya Tantra means techniques to remove them out of the body. In modern terminology, Shalya Tantra means surgery. Maharshi Sushrut is accepted as the first surgeon in human history. His work, Sushrut Samhita, is considered as a textbook of Ayurvedic anatomy and surgery. Maharshi Sushrut started dead body dissection for learning anatomy, also invented and described many surgical instruments which are even used till now in operation theatre, He also describes various types of dressings, bandagings, plasters. Sushruta explained laparotomy, which means methods of opening an abdomen. He also explained urine stone and gallstone removal surgeries. Sushrut also have explained various plasties which are widely used in today's plastic surgery. And my friends, this all explanation was in practice since Sushrut's era, that is 1000 BC. Another important treatment methodology of Kaya Chikitsa is Agni Karma. Agni Karma means application of Agni directly or indirectly with the help of different materials to relieve the patient from disease. According to materials used for the procedure, Agni Karma is divided as Snigdha and Ruksha. Agni Karma gives quick and long-term pain relief. It has very less side effects. It is an OPD based procedure, means hospitalization is not required for Agni Karma, and it is very much cost effective. Another important methodology of Kaya Chikitsa is Kshara Karma. Kshara are the caustic chemicals, alkaline in nature, obtained from the ashes of medicinal plants. Kshara destroys and removes the unhealthy and vitiated tissues. It can be used either internally in the form of its aqueous solution or externally as an application. Here we end up with our today's session. Let us summarize it quickly. Ayurveda basically has two aims. Prevention and promotion of positive health is a primary aim of Ayurveda, and secondly, cure from the disease. There are 8 branches of Ayurveda. Kaya Chikitsa means general medicine, Bala Tantra means pediatrics, Graha Chikitsa means use of Jyotish Shastra for treatment, Urdhvanga Chikitsa, ENT and ophthalmology, Shalya Chikitsa, that is surgery, Visha Chikitsa, that is toxicology, Rasayan Chikitsa, to increase health status and lifespan, and Vajikaran, to improve reproductive quality of an individual for better progeny. Ayurveda has explained 6 stages of a disease which include Sanchay, Prakop, Prasara, Sthana Samshraya, Vyakti and Bhed. As per Ayurvedic classics, our body is made up of 7 types of dhatus, and imbalance in them is called as a disease. Ayurveda classics describe 4 important pillars of Chikitsa. They are Bhishak, means a qualified and skilled physician, Dravya means medicine, Upasthata means nursing assistant, and Rogi means the patient. Besides the qualities of these 4 pillars of treatment, Kaya Chikitsa also explains ethics of medical practice. Kaya Chikitsa is chiefly divided into 2 branches, namely Shodhan Chikitsa and Shaman Chikitsa. Shodhan Chikitsa, in today's era popularly known as Panchakarma, and Shaman Chikitsa refers to all the procedures that reduce, suppress and eliminate a disease symptom. Action of any herbal drug depends upon 5 fundamental characteristics of the drug known as Rasapanchak, that is Rasa, Guna, Virya, Vipak and Prabhav. Kaya Chikitsa is also divided in another 2 types, Santarpana and Apatarpana. Most important aspects of Kaya Chikitsa are Rasayan Chikitsa and Vajikaran Chikitsa. Rasayan is a rejuvenation therapy, while Vajikaran therapy improves the functions of reproductive organs and vitalizes reproductive tissues, improves health of semen, and strengthens sperm motility in men. And other important branches of Ayurvedic treatment are Shalya Tantra, Agni Karma, and Kshara Karma. Here we end up with our today's session. Thank you.